Making the uterus and related structures. This video shows the making of uterus and related structures, hence the yellow pin. Start by cutting the piece in half. One will be used for the uterus and the other for the vagina. The uterus itself is slightly pear-shaped. There are two parts, the body and cervix. The cervix or neck is the narrowed part. It's also called the vaginal part because it extends for 2.5 centimeters approximately inside the vagina, and the opening is called the os. The vagina is a flattened hollow muscular tube. Here we are just making a long, thin, flat shape, and we just know it is hollow. The angle between an anteverted uterus and the vagina, such as in this case, is about 70 degrees. I am flattening this off here at the distal end to indicate the vaginal orifice. So there is our uterus and vagina. I'm going to take a bit of other to make the fallopian tubes and ovaries. Fallopian tubes are also called uterine tubes. The fallopian tube widens as they fan out into the infundibulum and fimbriae. Fimbriae are finger-like projections. One fimbriae is attached to the ovary, the rest fan out into the broad ligament. The fallopian tubes are about the same length as the uterus, from the fundus to the os. Here I'm making where the fallopian tube joins the ovary, and I'm using my finger tip to make the fimbriae. Remember, the uterus only attaches to one fimbriae, but in this model we are making the connection stronger. The spare material that I have here will be used to make an ovary on each side. They are an ovoid shape. I'm making it slightly teardrop shaped because I'm adding the ligament of the ovary. This ligament attaches directly between the ovary and the uterus. The entire structure sits within the broad ligament. I am using a toothpick to structurally support the fallopian tubes and ovary instead of the broad ligament. And to keep the toothpick supporting the ovary, I have it resting on a small groove. You can put the toothpicks through the ovary or the fallopian tubes or below like I have, whichever way supports the structures in your model. So there's the ligament of the ovary, there's the ovary, fallopian tube joining to the uterus, linking to the cervix, linking to the vagina, ending in the vaginal orifice. Making the bladder, urethra and ureters. Take one of the quarters and roughly form it into a triangular based pyramid to make the bladder. This is an almost empty bladder, whereas a fuller bladder is almost round. Now there's a triangle forming. The view from the top, as you can see. Now pinch out the urethra below. The ureters coming from each corner of the triangle. And the median umbilical ligament, which extends up to the umbilicus, coming from the anterior point of the bladder. urethra, left ureter, right ureter, median umbilical ligament. Where the urethra enters the bladder is the internal urethral sphincter, and at the urethral orifice is the external urethral sphincter. Now, this pin marks the bladder in blue. Now we are going to fit the bladder to the uterus and vagina. Here is the external urethral orifice, and there is the vaginal orifice. Now we're going to take a bit of our other quarter and use it to sketch out what would be the labia. You can see that the urethra is anterior to the vagina. In the anatomical position, the urethra appears in front of the vagina. When the woman is supine or lying on her back, the urethra is situated above the vagina. This video shows the making of rectum and anus. Take the red quarter. I'm rolling this into a thick tube about 2 centimeters in diameter. You can check that with your ruler to see that your model is a good size. The rectum has 2 flexures or bends, sacral and anorectal. This forms an S shape, which is important for continence. This is the anus end, and the rectum heads up into colon. This fits just behind the vagina and behind the uterus, following the curve. Mark it with the red pin. The anus is located posterior to the vaginal orifice. When the woman is in the supine position, lying on her back, the anus appears below the vaginal orifice. Making the clitoris. Another part of the female reproductive system is the clitoris. This consists of the glans clitoris, the body, and the crura, both left and right. This is located anterior to the urethra and vagina. Here is the glans, the body, left crus and right crus. The clitoris is made up of erectile tissue, equivalent to the male glans penis and corpus cavernosum. Also in this area, but not present in the model, are bulbs of the vestibule, paired masses of erectile tissue that run alongside the crura. Demonstrating anteverted versus retroverted uterus. The model you have made so far has the uterus in an anteverted position, with this 70-degree angle between vagina and uterus. This occurs in approximately 75% of women. In the other 25%, women have a retroverted uterus, where the uterus has a posterior tilt. This can cause an altered rectal contour, which means that the rectum conforms to the shape of the uterus. This is a normal variation of pelvic anatomy, and women can be born with this or acquire it later in life. It does not affect fertility or pregnancy. To clearly demonstrate where the cavities of the uterus and vagina are, I'm going to make another uterus and vagina and bisect it along the mid-sagittal line. fundus, body, cervix, os. I am joining this uterus and vagina in an anteverted position with an approximately 70-degree angle. I have just made an anteverted uterus. This is a retroverted uterus. If we compare it to our model, here is an anteverted uterus, and there is the retroverted uterus, and there is the altered rectal contour. Now to make a clean mid-sagittal cut to show the locations of the cavities within the uterus and vagina and the position of the cervix. This cut will make the right half of an anteverted uterus and the right half of a retroverted uterus. Now marking on the cavity of the uterus, the cervix, which has the external os and vaginal fornix, and the vaginal cavity. Marking on both of these uteruses. That's anteverted, and there is retroverted. Now I'm going to demonstrate the position of the cervix during a speculum examination. Here the woman is in the lithotomy position, that is, lying on her back with legs supported above her hips. I'm using 2 toothpicks to demonstrate the position of a speculum entering the vagina. And you can see that the cervix points towards the posterior vaginal wall, which is dorsal and down towards her spine. If the woman has a retroverted uterus, like now, her cervix points towards the anterior vaginal wall or ventral towards her abdomen. Peritoneum. The peritoneum is a thin membrane that lines the abdominal cavity and covers most structures in the abdomen. The visceral peritoneum covers the surface of organs, like so, and the parietal peritoneum covers the abdominal wall. Organs can be intraperitoneal or extraperitoneal. Retroperitoneal is posterior to the peritoneal cavity, subperitoneal is inferior, and preperitoneal is anterior. An organ is retroperitoneal if the organ has peritoneum on the anterior side only. It is not suspended by mesentery, which is basically a peritoneum sandwich with vessels running through it, if my finger was a vessel here. And the organ lies between peritoneum and the abdominal wall. Firstly, what I'm going to do is remove the pins for rectum, uterus, and bladder. Now I'm going to push the middle of the sheet of glad wrap into the recto-uterine pouch, or pouch of Douglas, between rectum and the posterior wall of the uterus. This immediately shows us that peritoneum covers the anterior surface of the rectum only, making the rectum a retroperitoneal organ. Peritoneum lies on both posterior and anterior surfaces of the uterus, And I'm going to tuck the glad wrap in underneath the uterus here into the vesicouterine pouch to demonstrate this. This makes the uterus a intraperitoneal organ. Intraperitoneal, both sides covered. Now, the fallopian tubes and ovaries are covered by peritoneum on both sides, and this has a specific name. This is the broad ligament, and it supports the fallopian tubes and ovaries within the pelvis. Finally, we will come to the bladder, which again only has one surface of the organ covered with peritoneum. Because it is the superior surface and the bladder is below the peritoneal cavity, the bladder sits in the subperitoneal space. So from the posterior side, you can see the rectum, retroperitoneal, the uterus, intraperitoneal, and the bladder, subperitoneal.